Hello, and welcome to Money, Power, Health, a podcast on how our health is influenced by commercial forces, wealth, and power. My name is Nason Maani. I'm a lecturer on inequalities and global health policy at the University of Edinburgh's Global Health Policy Unit. My background is in public health, and my research centres on the relationship between corporate power and health inequalities. I'm also a co-editor of the book, The Commercial Determinants of Health, which has been published by Oxford University Press late last year. We often tend to think of our health as the product of our own energies, something we alone are accountable for. But in reality, our health is to a large degree shaped by the conditions we find ourselves in, the quality of our air, the wealth of our parents, the food we have access to, our opportunities for work, our time for exercise. A new cancer drug might make headlines by prolonging life by a few months, but gaps in life expectancy between, for example, higher and lower income neighbourhoods in a city can be as much as 20 years. In other words, health is arguably a lot more about money and power and its distribution than it is about medicine. These upstream influences of health, which have been termed the social determinants of health, have been a focus of research and policy for the last few decades. It can be tempting to think of these conditions as purely a result of government policy or lack thereof, but the reality is there are other powerful actors that shape them. I'm particularly interested in the commercial determinants of health, the activities by the private sector and the structures they operate in that affect health and health gaps. These effects on health can be profound, affecting our health directly through the marketing and sale of harmful products, indirectly through the conditions in which we live or work, or even through shaping our politics, the generation of evidence, and how we, the public, understand health problems and solutions. When we think about the problems we've just faced as a global community, the inequalities that have been exposed and exacerbated through COVID, but also the profiteering, misinformation, and power struggles that have defined the pandemic. And then we look ahead to climate change and the role of powerful interests like the fossil fuel industry. It's clear we need to focus a lot more on money, power, and health. And that's what I hope to bring you on this podcast. Each episode will attempt to grapple with these issues, with the influences of money and power on health, with the help of guests from a range of academic, policy, and advocacy perspectives. I hope you find these conversations interesting, and I'm always open to suggestions for future guests and episode topics. On this first episode, I thought it'd be good to talk about the themes of the title and explore them a little bit with someone who has done a great deal of research on these topics. I can think of no better person for this than Sandro Galea, Professor and Dean at Boston University School of Public Health, who I had the privilege of working with during my Harkness Fellowship in the US and in the years since. Sandro is a physician, epidemiologist, and author, and prior to his academic career in public health, he practiced emergency medicine in Canada and in Somalia with Doctors Without Borders. Over the last 20 years, he's blazed a trail through public health research, teaching, and action, a true exemplar of his school's motto, think, teach, do for the health of all. He's published over 800 scientific journal articles, 50 chapters, and over 13 books, and his research has been featured extensively in print media. He was named one of Time magazine's epidemiology innovators in 2006, and Thomson Reuters listed him as one of the world's most influential scientific minds for the social sciences in 2015. Beyond that, he is a friend and mentor and a co-editor with me on our book, The Commercial Determinants of Health, published by Oxford University Press. Sandro Galea, hello and welcome to Money, Power, Health.
It's wonderful to be here.
Oh, it's a pleasure to speak to you as always. I guess we might start by speaking a little bit about one of the topics in the podcast title, money and its link to health. You've done a lot of research on this topic. Maybe could you explain in your own words what you see as the relationship between money and health, which seems to go far beyond simply being able to pay for access to healthcare?
Yeah, I don't think you can even have health without thinking about money. I think money and power are core to how we think about health. So money is obviously a shorthand for resources of many kinds, but fundamentally, it buys you the resources that create a healthier life. And that starts from early childhood, where having money, having resources allows you to be in a better pre-K, better schools, better neighborhoods, all of which goes towards you going then to better schools that make you more income, a better job later in life. Essentially, all the conditions of where we live throughout our life, work, play, are shaped by resources, money being a shorthand for resources. And health is a product of the world in which we are born and the world we live in. And, that at some level that sounds abstract, but one can think of it at very easily at the extremes. I mean, obviously, it's not a stretch to say your health is endangered if you're living in a place which is going through a war. That's an extreme of saying environment. It's also easy to understand how your health is worse off if you're living in a very polluted environment. Again, these are sort of obvious examples. But those examples translate through all aspects of how we live. They translate through every element of how we live. The assets we have allow us to surround ourselves with environments that either help our health or hurt our health.
This reminds me of the story of Sophia in your book, Well, which you return to throughout the book, and through it show the ways in which inequality in the form of income affects her throughout the different stages of her life. But what struck me about your book, Well, is that you have separate chapters on money and power, and you show the way in which power affects health and health inequalities in ways that are distinct simply from the allocation of material resources. I was wondering if you could speak to that a little bit.
I mean, obviously, money and power are intertwined, and having power gives you access to money, and having resources gives you access to power. But I do think that power matters separately from money, because power ultimately refers to the structures in the world around us and what privileges they afford us, and that affects health. Perhaps an obvious example, or upon which there has been quite a bit of discussion in the past few years, are forces like structural racism. Forces of structural racism are a manifestation of power. It is power to include or exclude people as defined by racial identity. And forces of structural racism mean that people, in this case, certainly in the US context, that's typically used to refer to the systematic exclusion of Black Americans, means that Black Americans have historically had less access to health-producing resources, be that healthier neighborhoods, be that being around in neighborhoods where there are grocery stores which sell better foods, be that being in neighborhoods which are free from gun violence, or be that access to hospitals that can help restore people to health once they're sick. So those are all elements of power that structure the conditions in which we live. I mean, perhaps the way to understand it in the context of the intersection of money and power. So we think of money, we think of income. Well, you have to recognize that wealth is transmitted across generations, and the accumulation of wealth goes back to whether or not your family was permitted to buy homes 100 years ago, which of course becomes wealth transmitted on generations. And it is power that determines who is allowed to buy homes and where. And that then translates into money, which then translates into health.
So, Sandro, a listener to the podcast at the moment might be thinking, particularly if they're from a healthcare background, might be thinking, well, yes, this makes intuitive sense to me, and I've often seen the extent to which gaps in health outcomes reflect wider gaps in money and power. But these are really issues that are far beyond me. They can only really be solved at the ballot box, if they can be solved at all. And so for me, as someone who works in health, as someone who's interested in measuring tangible things, what I can focus on is healthcare outcomes and dealing with the acute consequences of these things. But when we talk about the wider distribution of money and power, that isn't really something for me to deal with. And I thought I'd ask you about this because you started at the coalface. You began your career as an emergency physician. You worked for Doctors Without Borders, and you decided at some point that there was real value in transitioning from that type of service to thinking about the health implications of the wider distribution of money and power and the social determinants of health. So I was wondering if you might reflect on that with us and describe how you see the value of doing academic research that focuses on these upstream factors.
Well, I think there is immense utility in shifting culture, shifting norms, shifting conversations. And I think that is where the work of scholarship and communication comes in. And that's both in academic communication, but also non-academic communication. So, Well, the book which you kindly referred to, the subtitle is What We Need to Talk About When We Talk About Health. And really it's a very intentional subtitle, because then what the book is about trying to shift how we talk about health. So I do think that understanding these forces and understanding, for example, understanding that a political decision that is made around creating a playground is actually people's health, means that we, the people, are going to be more engaged in that decision, and we are going to insist on a particular decision because we care about our health. We've done surveys, and others have done surveys that ask people, what do you think matters most for your health? And the truth is that most people continue to say that what matters most for their health is their doctor. In fact, what is interesting is that people are least likely to say that politics matter for their health. Well, I would flip that. I think politics matters more for our health than anything else, because politics ultimately is about the distribution of resources in society. And those resources are what matters to our health. So I suppose I do believe, and I cling to a belief, even if sometimes it's naive, that the work of generating ideas to the end of shifting how we think about things really matters to how we structure our society and to ultimately to people's health.
I think that's right. I mean, I'd like to think that that's the case. But with that, I guess the power of ideas and of thinking about these concepts and bringing them to the attention of the public, there is also a responsibility, right? And it strikes me that this is something you've grappled with in your past work. I mean, one of the things that you've really, I think, articulated along with others quite forcefully is that, particularly in the US context, health should be about a lot more than healthcare. But often, in terms of spending, in terms of focus, in reality, healthcare dominates. But health is about a lot more than healthcare. But another strand of your thinking and scholarship, to my mind, is that life is about a lot more than health. And you've talked about things like proportionality and being cautious with placing an undue emphasis on health and seeing it as a means rather than an end. I was wondering if you could speak a little bit to that.
Well, that's actually a great way of putting it. I wish I had thought of that. There's much more to health than medicine, and much more to life than health. I may use that actually. That's a great distillation, I think, of things I really feel strongly, and I agree completely. I think the sometimes we make the mistake in health in thinking that health is the end, but health is not the end. Health is the means. I mean, what is the point of being healthy if you cannot use that to live a richly realized life? I mean, one of my colleagues uses the term, which is a bit jarring, this notion of a human zoo. We wouldn't want to be in a human zoo where we are looked after and fed healthy food and made sure that we exercise just so we can be healthy. Because we actually want to live a full life. And I think when you understand that, then you realize it changes a little bit how one thinks about health, because one wants to be healthy so you can actually get on with things and do what you wish to do. And I think those of us in health need to accept that we're creating health so people can do what they want to do. A metaphor that perhaps applies to that is, your car, leaving aside the environmental and health effects of cars, but leaving, you don't want your car to run well just so that you can admire it. I mean, maybe if you're a collector, but most of us, you want your car to run well so you can actually use it to get you places, right? The health of the car in and of itself is only a means to the end, and the end is getting places. And I think that is true for health as well. And this has really profound implications, I think, for how we think about going about health, because I think sometimes we are willing to impose on people's lives to make sure that they're healthy without recognizing that there's a trade-off in restricting how people wish to live their lives. There's always a trade-off. And I think we need to be thoughtful about what trade-offs are worth it or not. I mean, to use one concrete example, it is a constraint on people's lives to insist that everybody wears a seatbelt when they're in their car. It is a constraint. I mean, I can say, I want to be in my car without a belt that ties me down. I think we broadly agree in public health and society has arrived at a consensus that it's a very reasonable constraint. That simply sitting in your car and saying that, and having a belt around you, yes, it constrains you, but let's face it, it's a very small constraint, and it's well worth it so you don't die when your car hits something and you fly out of your windshield. So that's a constraint that we've considered reasonable. But let's stick with the car example. In this country, just talking about the U.S., speed limits are many places 45 or 55 miles per hour. Now, we know very well that if the speed limit, every 10 miles per hour, the speed limit goes up, more people die in car accidents. And I don't have the data in front of me. But if the speed limits everywhere throughout the U.S. were 25 miles per hour, everywhere, then we'd have tens of thousands of fewer people who would die. Now, we as a society, that speed limit should be 25 miles per hour everywhere. Like, why don't we say that? I mean, fewer people would die. So we are making that trade-off. We are accepting that that's a greater constraint that we're willing to make as a society. So I think that our purpose in health is to allow people to live their lives, but then it's not so simple. It creates this complicated discussion in society that we should have about the trade-offs that we're willing to make, what we're willing to give up in us living the life we want to live for the sake of being healthy. And we in health should be honest that there is that trade-off, there is that conversation.
Yeah, I think these are really important points, and they relate to another aspect of the power conversation that I wanted to have, and linking back to the title of the podcast, which is the role of commercial power and the way in which it too can really shape individual choices. And those choices can include healthy or unhealthy behaviors, but beyond that, corporate power can shape choice architectures, the world around us, the social, the physical world around us, the types of social norms that prevail, how we think about the role of evidence or of government, and even how we frame the world of the possible, the ways in which we might solve problems like, for example, climate change. And I just wanted to reflect with you on that a little bit and get your sense of the role of the commercial determinants of health and how we can best think about that power and its influence on health and health inequalities.
Yeah, the work I've done on commercial determinants has always come from a place which sees commercial forces as yet another macro force that shapes the world around us. I think if we're going to understand that the world is shaped by the conditions where we live, work, and play, you have to understand that many of those conditions are shaped by commercial actors. And that doesn't mean that commercial actors, and I think there is a perhaps a reductive understanding of the role of commercial forces to say commercial forces must harm health. I don't think that's true at all. Commercial forces simply shape the world around us, and that shaping can be positive or negative. So I suppose I've seen my work as trying to illuminate how commercial forces shape health to the end of elevating the positives. Now, within that, I've also written about commercial forces and how they intersect with power, to take up the theme of power. Because, of course, power weaves its way through the establishment of commercial forces and the role that they play in our lives. And I think it's inextricable then from the dominance of particular commercial actors and others. So all these forces really go together. So I think thinking about commercial determinants of health is directly in line with my thinking and writing about money and power and health. And my encouragement is for us to see commercial forces as yet another force that can be channeled positively once we understand the mechanisms of its action.
No, I completely agree, Sandro. And it strikes me that something that I've noticed right from the beginning of my career, which was as a bench scientist doing biomedical research, was that one of the key roles of science is to bear witness to the forces that shape the world around us, be those micro forces like the interactions between atoms and molecules, or macro forces, and be those physical forces like gravity, or social forces like inequality. And it strikes me that the role of corporate power within countries, between countries, is something that really should attract a lot more attention, a force that science should increasingly bear witness to, rather than it being a question of ideology or a question of focusing purely on the producers of products we can all agree are harmful. Maybe one example that might be useful for you to reflect on is the example of the healthcare industry in the US, which is a context you know a lot about. I mean, it strikes me that there is value in applying a commercial determinants lens there, because even though ostensibly these are companies that produce health products and health services, they're also a really powerful business lobby, and they seek to maximize profits, even when that means that treatments are very expensive, access is more limited than it could be, and so forth. So maybe if you could reflect on that as an example of why there's value in a commercial determinants of health lens far beyond harmful products.
I think so. I think the healthcare industry in this country is a perfect example of how corporate action happens within the constraints that we set. And by we, I mean we, the people of society, the public, our public representatives, set for corporate actors. And, I think when we think about corporate practices, one quickly slides into, well, corporate actors do things illegally. Leaving that aside, I actually think is actually quite rare. I think that what really matters much more is corporate actions that are perfectly legal, working well within societal limits. So the healthcare industry works within the incentive structure that it has. So when you have, for example, a payment scheme that rewards me, the healthcare actor, for seeing sick patients, my every incentive is to see you with your high blood pressure every week, to check your blood pressure and tell you your blood pressure is high. If we have an incentive structure that rewards me, the provider, to make sure that your blood pressure is low, stays low, and you never have a stroke, then all of a sudden, I don't need to see you every week to tell your blood pressure is high, and I actually can be part of a structure that makes sure you eat well and exercise so your blood pressure doesn't get high to begin with. So it really depends on the incentives. And I think the healthcare industry is no different than any other industry. It behaves to the incentives. And this is where I don't think you can even think about corporate determinants separately from political determinants, because it ultimately is on the population to establish the values that it cares about and to use those values to create the incentive structure within which the various actors operate, including corporate actors. And if we value our health rather than we value going back to the hospital time and time again being sick, then we should incentivize that.
Absolutely, Sandro. A lot to reflect on there. And certainly these are things that we'll explore in subsequent weeks and months on the podcast, the interplay between the political and social and commercial determinants of health. Our time is nearly up, and I thought I'd use this opportunity to reflect a little bit on these themes and their implications. I'm actually just in the process of teaching my first course at the University of Edinburgh, and it's on the social determinants of health and public policy. And it includes in the class some medical students who are intercalating. And I thought it might be nice to end the podcast by asking you what you would say to them about the role of these forces and how they influence health. Because of course they're interested in them, but they're also training as physicians and are going to be dealing with I guess the downstream impacts of these forces.
I think they're essential to the work of health, and physicians are seen by society as being the spokespeople for health. So I think physicians need to engage. At the same time, physicians' day-to-day job is curing disease. And I appreciate that, I understand that, I respect that. So my ask of physicians is not that one engages with big issues of power and money on a day-to-day basis, but one understands them and one realizes the impact that that has on the individual patient one is dealing with, and also that the physicians have a particular role and a responsibility to engage in larger processes.
Thank you so much, Sandro. I'm sure they'll appreciate that reflection. It's been a real privilege to speak to you today. Thank you for sharing your time with us, and I look forward to speaking to you again soon.
Thank you for having me, Nason. Thank you for doing this.
Well, that was my conversation with Sandro Galea, and that was the first episode of Money Power Health. I hope you all find it interesting. I certainly enjoyed it, and apologies for any technical glitches or audio problems. I mean, that's just the nature of me figuring out how to do this. I look forward to sharing future episodes with you. And again, if you have any thoughts about guests or topics you'd like to cover, please let me know. I'd be delighted to hear from you. Take care, and I'll see you next time.